as you can hear, I don't have much of a voice left, but this was important to me to be here today, and really important for me to be able to bring my daughter in. We're from Reno, Nevada, and so it was a quick flight over the mountain last night and a not so quick drive down from San Jose this morning. Really, really an honor to be here and to be back. I remember the first time I met Dr. Bellavita. Back to the award, I was sitting in the Fusion Leaders course as the emergency manager for the state of Nevada. And we'd been there for 5 days. I'm not sure if any of you have taken that course. I'm sure many of you have. We'd been there for 5 days, 4 hours in the morning, 4 hours in the afternoon. We were all pretty worn out. And on the very last day, our very last instructor was Dr. Bellavita. It was the first time I met him. And he got under my skin in a way that I cannot explain. Just the challenging questions, and I thought, why is he talking like this to us? And by the end of the class, I was just absolutely enamored with him because I finally realized what he was doing and the way he worked his subtle humor in and all of those things. And so when I came back as a master's student, immediately started in his intro course like all of us did, and have been one of his acolytes ever since, and just a huge fan and a huge believer in what he does, and proud to call him a mentor. I'm not sure if he's proud to call me a mentee, but just an incredible honor to be back here and to receive that award in his name. The work I'm going to talk about today started under his guidance. He was my thesis advisor when I was here in 2016 and 2017. Like I alluded to a moment ago, I was the emergency manager and Homeland Security advisor for the state of Nevada. We had been going through floods and fires and all of the typical things that we experience in a high desert place like Nevada. And I was writing about resilience, community resilience, not personal resilience, as we heard about before, which is incredibly important, especially for people who are managing crises. But I started to understand, or tried to understand, this concept of resilience and what does it mean to us. And I still don't think I have a good grasp on what it means completely, but at least working knowledge at this point. So I wound up writing my master's thesis on 3 case studies in the state of Nevada and some specific things that came out of the politics around emergencies and disasters. And I submitted my thesis on September 29th, 2017. And we graduated December 15th. I was super proud of myself. I'd met my goal of getting it in well ahead of time and ready for review and all of those things. And then October 1st, 2017 happened, and the largest mass shooting in U.S. history happened on the Las Vegas Strip in southern Nevada. So that was on Sunday night, and so we were active for several days. And on Thursday morning, I got a call from Dr. Bellavita, my thesis advisor, and he said, I think you need to write another chapter to your thesis. And I will not repeat in front of my daughter what I said at that moment, because I was knee deep in an extraordinary crisis. And had already finished my thesis and submitted it. I said, I'll think about it. And I knew what I'll think about it meant at that time, but I don't think I was ready to admit that to myself. So I went back over the next week and just tagged on another chapter. It was all so fresh in my head, and it was really applying everything I'd already done. And he was right. Everything that I had written about, right or wrong, was challenged by what was going on in the 1 October mass shooting, and the response and the recovery that continues today. One of the key pieces of that recovery was the concept of community disaster resilience, and how we as a state are organized for emergency management and homeland security for risk. We're not organized for resilience as a community. And this is something that scholars and academics have continued to argue about. It's becoming more prominent in the literature. But it was something that really became, it was the one thing that I think was usable that came out of my master's thesis. So after a few years, I decided to get into a PhD program at the University of Nevada, where I continue to study this today. So I'm going to talk to you a little bit about some of these concepts of disaster resilience. Hopefully I can talk for about 30 minutes here. and then would love to take some of your questions. But I want to talk about it in terms of COVID-19. And so I had left the position of emergency manager for the state and came back to the governor's office during the COVID-19 pandemic to lead Nevada's response. And so through this, through graduate school, through ongoing conversations with people like Dr. Bellavita, with people in my program, I've continued to look at what disaster resilience means and how we can learn from the COVID-19 pandemic. So that's what we're going to talk about a little bit today, hopefully. And hopefully this is meaningful and we can have a good discussion based on it. So I want to set the scene a little bit here and take you back to where all of this sort of started to come together in my head, which was November of 2020. November of 2020, I'd been the COVID-19 response director for the state for about 6 months at that point. You can see the red line indicates November 2020. It indicates where we are in this time. And there's a reason why this is a particularly important time for us. That first surge you see around July of 2020 is really the first spike in cases that we experienced at the state of Nevada. So we had experienced a trough coming into the summer, just like everybody said we would see a spike, and then as things started cooler in the fall, then we would see a second spike. Now, I just want to talk about where we are in the state of Nevada at this time. That first spike that you see back in July lasted about a month and a half, 2 months, just like it did everywhere else. These are measuring daily new cases. So just a graphic depiction, but it's the same curve that would be for percent positivity for everything else that we're doing. But this is measuring daily new cases. Prior to that July 1 surge that we saw, the governor had shut down, had imposed a stay-at-home order in the state of Nevada, as many governors did around the country. And it devastated the state of Nevada. For the first time, I could see pictures. I didn't go down and see it because nobody was traveling. I'm in the north. But you could see pictures of the Las Vegas Strip that looked like a ghost town. I'm born and raised in Nevada. That's just unbelievable to me. It's unbelievable to me from a cultural standpoint, just what that means to our state. But it's incredible, unfathomable to understand what that meant to our economy. 65% of our economy is generated from that 4.2-mile strip of land called Las Vegas Boulevard in southern Nevada. And it was shut down in an instant. Around the same time, prior to the spike, you have all kinds of other things going on. You have a legislative session that's called into a special session to cut 25% of our operating budget. 25% of our operating budget and all of those government services that were associated with that, because the revenue coming from the Las Vegas Strip, from companies around the state, was simply gone. You have hi, sorry, classmates here. You have the George Floyd incident and the Black Lives Matter protests that occurred after that in May, at the end of May, right before this, and so we're seeing those pieces happen. All of those things that happened, and we're getting ready for the second surge, and we're seeing these numbers climb here in late October. We're getting nervous, and we're looking at this, and we're wondering, what do we do? What we had was the same problem that we had back in June, heading into November. We were waiting for the second surge. There was no end in sight. As you all will remember, people were talking sort of theoretically about a vaccine at this point, right? This is a month and a half before the vaccine is even approved by the FDA. And but people are saying things like on conference calls that we're having around the state and with national partners, people are saying things like, if we get a vaccine, or if the vaccine works, or things like that would put us, basically kept us in a situation, an unknown situation. So we knew that we had the same problem. We knew that we would have the same goals, and those would be balancing lives and livelihoods in the state of Nevada, something that drove all of our policy recommendations to the governors. We had to make sure we were protecting the hospitals and the workforce because, like every state, we have limited hospital capacity for these major surges. And we had to make sure that we were ensuring that we were competing for nursing staff, medical staff around with everyone else around the country and, frankly, around the world. We were also just climbing out of the supply chain issues that we were experiencing in the state and that the world was experiencing at that time. Although we had figured out a few things on that, we were still unsure of what this second surge would look like. We also had the same bad options in front of us. Again, there's no vaccine at this time. All we could do was require or recommend to the governor that we require masks, that we require social distancing, and that we do closures. We didn't want to do that. Nobody wanted to do that. Everybody was fatigued with COVID-19 at this point and remains so today. And we knew that those were limited options and that we had done it before, but those options were even more challenging for us this time because in the second round of doing this, we had decreased economic resilience in the state. I already told you, shutting down the Las Vegas Strip for 2 to 3 weeks resulted in cutting our budget by 25% for the state of Nevada. We had decreased government capacity for services. Same reason. We were not able to provide outreach. We were not able to provide mental health services. We were not able to do a lot of things. Schools were closed. You've all experienced these same things. Most important, perhaps, for us in all of this was the effect of decreased public support. During the first surge, when we recommended implementing changes, there was support. Okay, this is bad. Most people admit it, or I don't like it, but I'm going to go along with it, or I don't really have an option. And that was really changed because I think we were seeing increased rhetoric from the president against a lot of these measures. So our entire situation had changed as we were heading into November, but it also had changed in another way as well. And that's what we refer to as the maturing response in the state of Nevada. We were learning lessons learned from our first iteration of mitigation measures that we were hoping to apply more fruitfully in the second. The science behind understanding the disease was much better in November than it was in May. Just unbelievably better, just from how doctors treated the disease for people in the hospital to how we prevented it to how it spread. All of these things that we may forget about now were all learning by discovery at that point by people much smarter than I, much smarter than most of us who were on this at the state. We'd learned lessons on procurement issues. We'd tackled some of the supply chain issues by bringing things in-house, making our own equipment, using all kinds of different innovative ways, engaging the private sector in order to do that. We also learned that it was the best thing we could do was to ignore the national conversation and engage locally. We had not done a good job of local engagement throughout the first iteration. A lot of the decisions that had been made were made on the fly and and therefore we couldn't receive support and buy-in from our local leaders. And we learned the lesson that we should have known going into it. We did know going into it, that we could always collaborate more, we could always communicate more, and that had to be constant and ongoing. So back to where we are in November, you see we're at the beginning of this curve here. There's clearly a spike happening. We don't know everything that's happening to the right of this yet, but we see those numbers just to the left. We see it's climbing. We're hoping that it just gets up to June, July ranges. But based on previous information, we knew that the second surge was going to be even worse than the first for a number of reasons, and for a lot of the reasons that I've already discussed. So what did we do? We called together members of the community, and we applied the lessons that we had learned. We said we need to communicate more. We need to collaborate more. We need to tell people in this state, leaders in this state, how severe the situation is for the state of Nevada with our limited hospital capacity. We had to communicate the severity of the problem. We had to tell people what our limited options were. Limited hospital capacity in the state of Nevada meant a spike was going to overwhelm us. Even a minimal spike in most other states would really, really have significant consequences in our state. So we sat down with leaders In the early days of Zoom, we called 3 different Zoom meetings. This was the governor's chief of staff called these together, these different groups, economic development and industry leaders, to talk about what we were doing, what we were facing, and what our options were, just to communicate with them and to get buy-in from them. Schools were still struggling with closures and shutdowns and all of these things at this time. So we brought in education leaders from across the state in a second meeting and discussed the same things with them. And then finally, we brought in policymakers, either at the local level or the state level, to talk about, again, the severity of the problem and the limitations on our abilities to respond. We engaged in that two-way conversation, and we implemented a lot of different measures along the way through learning and developing this process to better engage and to better collaborate. But we really engaged for the first time across the board, categorically, in these 3 areas with the state. And we began this meeting with an outside advisor. So there's a gentleman in the state of Nevada named Jeremy Aguero, who is basically an economic analyst for the state, but he's extremely respected across the board, bipartisan, respected by both parties, and really a leading figure and a public thinker in the state of Nevada. And so we asked him to begin these meetings and tell us, to frame the situation for us. We had no idea what he was going to say. Jeremy's a noted, sharp thinker and speaker, so we just turned it over to him. And he said, we all know about the public health crisis in the state of Nevada. But what I'm telling you today is that we actually face 5 crises in the state of Nevada. And he spoke for about 5 minutes, and he listed off and detailed those different crises. And he said, we have the public health crisis. We all know that. That's number 1. That's at the top of our list. We've got to keep people healthy. We've got to maintain hospital capacity. We've got to prevent the spread of the disease. We've got to do all of these things we're doing. But there are secondary and tertiary effects of this that we're experiencing as well, some directly related and some not. Those are economic. I've already talked about that. Shutting down the Las Vegas Strip, or not just shutting down the Las Vegas Strip, but shutting down Nevada's economy for 2 weeks had an incredible impact on the lives and livelihoods of Nevadans. And we knew that it was going to be difficult to dig out of that. That contributed directly to a revenue crisis or a fiscal crisis in the state of Nevada. As I said before, in June or July, we held a special session of the legislature to cut $1.25 billion from our annual budget just to keep services open that we could keep open. And we knew that the economy would recover very quickly once there was a vaccine, once there were all kinds of other things that were in place. But we knew that the state and local governments would be 10 years behind, or we believed that we would be 10 years behind. So the fiscal crisis coming from the economic crisis was extraordinary. He said, we're experiencing a social and political crisis right now. Look around the streets of the state of Nevada. Look around the streets around the country. You have people who are politically against the activities of the state and these mitigation measures, and they're making their voices heard. You have groups like Black Lives Matter who are going out around communities at the state as well and demanding change. And those 2 groups are intermingling in certain instances as well. And so there was uncertainty around that. And then he said the one that surprised me the most, which was, we're facing a legal crisis. Never before has the governor of the state of Nevada used such extraordinary emergency powers during a declared incident in the state of Nevada. And all of these decisions, not all of them, many of these decisions were being litigated in court at this time. And so the nature of governors' executive powers were completely in question and uncertain at that time. Listening to him, I've had this conversation with several people. Jeremy was able to completely reframe the situation for us. We all knew it was a complex crisis. We all knew that the pandemic mitigation measures contributed directly to the economic impact, which contributed directly to the fiscal side on the governor's side of things. The government side of things. We knew that this social political turmoil was going on, and we were responding to court cases, which were amazing. I could do another talk on their own in a unique place like Nevada. We knew all of these things were going on, but we were really focused on the pandemic as the standalone crisis and not seeing it for the complexity as it was. His framing did not change the problem for us. It did not change our options, but it completely changed the way that we thought about how we were responding. And it made us go back and rethink the measures that we were taking at the state and how we could improve upon those as well. I think that's really important because of what happens to the right of this slide right here. Back to November, we have this huge surge that takes us into January and February of 2021. And all of those conversations that we were able to have and the way that those conversations changed our thinking around this really allowed us to respond better and more effectively. This also coincided with the introduction of the vaccine as well. So it was a remarkable time, a transformational time for us in the state. We were able to weather this second spike, which was more than twice the number of daily cases we had in the first spike, much better than we were the first time. And so that was about learning and how we as an organization learned and how we learned around policy and all of those things, which are the things that, again, that I'm studying right now. And I want to talk about a little bit right now. So that complex crisis that is COVID, those 5 crises that we experienced in the state of Nevada, and I would argue every state experienced some similarity of those crises, changed everything that we understood about emergency management. I shouldn't say that. Challenged everything that we understood about emergency management. We still operate in the same way, the 4 phases of a disaster: mitigation, preparedness, response, and recovery, but it changed the way we think about those. How do you mitigate a disaster, a complex disaster or a complex emergency like a public health crisis that's going to take place over 3 years? There's simply no amount of capacity to mitigate at that level for such a prolonged and slow-moving crisis. How do you prepare for an event, a protracted disaster, protracted complex disaster, when really most exercises were about 3 days? Very first exercise I did as emergency manager in 2015 was a public health pod exercise. It lasted 3 days. There was no way that we could be prepared for a 3-year pandemic or even a 1-year pandemic based on those 3 years of training. How do we respond when you have so many different complexities? We talk about complex crises, but how do we respond when the social and political side is just as important as the public health side and getting that buy-in? And of course, recovery, which we're still trying to figure out right now. All of these things were challenged. You know, the IA and PA were not deployed through FEMA during COVID. These were congressional acts because it was such a new type of emergency, at least for the last 100 years. It's also changed the way scholars have evaluated and understood crises, emergencies, disasters theoretically. Desiree Crowe, who's a professor out of the University of Colorado in Denver, and others wrote a paper about policy learning and said we really have the beginnings of a concept of preemptive policy learning, and how organizations are looking at, in these prolonged crises, how organizations are looking at other states. One state would look at another state to anticipate what was coming in their state, and all of these things which really hadn't been talked about before. Thomas Birkeland, who's one of the leading thinkers on the policy process as it relates to disasters, had presented 20 years ago, 15 years ago, presented a concept based on John Kingdon's concept of focusing events called potential focusing events. And that concept hadn't been refined in any significant way in about 15 years until COVID happened. And he and other scholars went back and looked at his concept of potentially focusing events in the agenda setting process and said, this doesn't fit. This disaster that we're talking about doesn't fit these characteristics. We have to refine our theoretical model so that we can provide better information for practitioners. Then you've got the famous 5 key tasks that were really presented as a foundational model, not a model, really sort of a broad framework for understanding how leaders respond, public leaders respond through these 5 key tasks. And people like me and others are looking at these going, these are important. These are starting points: sense-making, decision-making, meaning-making, terminating, and learning. These are important starting points for us to understand, but they're inadequate. They're inadequate for us to understand the real leadership challenges, the political processes, and the policy processes that are associated with this. So if we are to mature as a field, and I know that we're across all of the public safety fields here and Homeland Security fields here, I think we have to continue to learn and continue to be challenged by what COVID-19 means to us. I, like all of you, like probably most of you, want to put COVID-19 in the rear view and keep moving forward, but we can't. We have to think about what this means. We have to think about the fact that, maybe not the fact, the possibility that crises, emergencies, disasters are going to be more complex, much like COVID-19. They're going to be more prolonged. They're going to have more significant consequences. We have to engage in social learning, not just instrumental learning. We can't just go back to our plan for the event and say, well, we needed to activate the emergency operations center 3 hours earlier here, so we're going to change these policies or change this part of our plan through an improvement plan to do that. Those sort of instrumental changes, those one-off changes that we're making, we have to go back and really think about this from a social context. How are we learning? What are we thinking about? What are our basic assumptions about prolonged complex disasters? I argue that we have to contemplate crises in terms of risk and resilience. That's risk analysis versus risk perception. There's some great literature out there on how experts view risk versus how individuals view risk and how they're basically the opposite of each other. We have to think about, all of us pretended to read the social construction of reality in Brannon's course, I'm sure. We have to think about that book and what it means to emergency management and what the social construction of risk actually means. Why does the individual at the community level view risk differently than the expert who's the engineer? We have to think about vulnerability and what vulnerability means for different communities, and that risk isn't applied across the board. And I would argue as well that we have to think about resilience. We have to think about how risk and resilience can complement each other. I'm not going to go through a long literature review here, but I want to say that there are two fields that are really looking at these concepts of risk and resilience. They come out of public administration, is really doing some important work in the area, and sociology since the 1950s has been doing incredible work on these concepts. And each one of them take a different look at risk and resilience and have informed each other over time. I think the resilience conversation's really been happening over the last 20 years, and I think it really, combining those two, give us an opportunity to better understand what risk and resilience mean. To me, this is what they mean. Risk is a top-down approach, and please realize I'm saying these are not one or the other. These have to go together. Risk is a top-down approach of risk analysis, risk mitigation. It's government agencies coming in and assessing, evaluating critical infrastructure or what hazards mean for different communities from the top down. From resilience, you take a bottom-up approach to that. You go back to those lessons learned, those lessons we should have known when we were heading into November, and think about why we weren't engaging the community more, why we weren't having those conversations with local leaders more to get their input and allow them to drive some of those conversations we were having. Again, risk is something that's really engineering and math-based. For all of us that have had the pleasure and honor of conducting a THIRA and an SPR year after year for grant requirements, we know how technically based these risk assessments are and hazards assessments are. Resilience looks at it from the social aspect. Or from the social vantage point, how are communities viewing these things? Do they value that bridge that the county values because it's critical infrastructure? Or do they say, I just need access to the hospital and I need these stores to be operating? How are they viewing these things differently? Doctrinally, risk looks at recovery to pre-disaster conditions. Maybe some mitigation tags that we can throw on there as well, but it's getting back to pre-disaster conditions. Resilience talks about coming back stronger, and this is actually the most controversial part of this, the idea of coming back stronger, but the notion that a community can use disasters as an opportunity to rebuild and restructure. And then risk is focused on government resources, and resilience is focused on social capital. So in an emergency or a disaster, we We respond by sending government assets, whether those are fire trucks or police officers or public health experts or building a hospital capacity. We do all of this from the top down because those are the resources we have, and that's what the community wants. Some of the best recovery efforts that are going on out there right now, I think we've all read about this, are happening from a neighbor to neighbor or at the community level. Those resources lead to recovery at a much better level. So I'm going to go ahead and stop there at just over 30 minutes, and would love to take any questions you might have. Would love to take a drink of water and hear from all of you on this concept.